Hi, I'm Anne Marie. Welcome to Whiteboard Wednesday. And today we're going to be talking about how to choose the right system for your practice size. Practice size could mean how many providers. It could also mean how many patients you're seeing every day and how many exams you need to have done. I think it's more important to consider a system that's going to meet the clinical needs versus thinking about the size of your practice. But if that is a consideration for you, there's some things I would think about. One of those is going to be the hard drive space on the system. How big is the hard drive? How many studies can it hold? How many patients can you scan? Typically speaking, cart-based systems tend to have more storage space on them than portable systems, unless, of course, you have permanent storage. So if you have permanent storage to PACS, then the hard drive space doesn't tend to be an issue. So typically speaking, I don't like to consider the size of the practice when looking at an ultrasound system. I prefer to consider what are your clinical needs. Does the system answer all the questions that you have? Can you do the studies that you need to do on the system? If you're scanning abdominal scans, does it have good imaging? If you're doing cardiac, does it have all the tools that you need to complete your studies? I think that's more important than the size of the practice, because the other questions about storage or all of those things can be answered with a permanent storage solution. And that can be done either with a hard drive in your office or, again, with a PAC system that you can send your studies to at the end. Again, to me, the quality of the system and does it meet your needs is more important than that item. But if it is something that you're curious about, feel free to comment below or give us a call.